So we do have three speakers. I want to thank our three speakers today. We have Mary Lou Brncik, Beya Thayer, and Dorothy O'Brien. Each of them will have approximately 10 minutes to present. And after that, as Candy said, we'll go into a discussion mode. I'd like to first introduce Mary Lou. We'll start with Mary Lou today. Mary Lou is the founder and president of David's Hope, Arizona Mental Health Criminal Justice Coalition. Her son David was diagnosed with schizoaffective disorder when he was 23. Soon after that, his life intersected with Arizona's criminal justice system, and those events led Mary Lou to years of battling both the mental health and criminal justice systems to get treatment for her son. So she has, with her family, experiences from the inside, and through the years led, I would say, led a movement and brought a lot of empowerment to people and attention. So with that, Mary Lou, I'll turn it over to you.
Hi, thank you, Lori, and good morning, everyone. I appreciate very much the invitation to be with you this morning. As was previously said, I'm the director of David's Hope, and the Arizona Mental Health Criminal Justice Coalition is actually a program that we adopted from the Maricopa County Adult Probation Department, which was in the Maricopa County jail. The director at the time, back in 2012, was Dr. Dawn Noggle, and she was really the driving force that started this coalition that we still have today. Unfortunately, she retired a couple of years ago, and now we're in a little bit of a different place. But our goal is to keep the Arizona Mental Health Criminal Justice Coalition alive. And the way we're doing that is through the support and commitment of people like you all who have been touched by someone that you know and love that has a mental illness or an addiction, and who has crossed into Arizona's justice system. When I started doing this, I wasn't trying to start an organization. I was trying to save my son from what looked like years of prison, and kept running around frantically thinking, surely when they realized that he was sick, at the time he didn't obey the officer's commands, that it'll all be okay. It'll all straighten itself out and everything would be okay. Well, he'd gotten tasered more than once through the years, but initially he had gotten tasered up in Peoria like 6 times in the back. He was running in circles and the officers had surrounded him, and they were going to send him to prison. I mean, it was pretty evident that because the charges were aggravated assault on a police officer, they don't like to change those types of charges. So back to the CIT you all were talking about, that's why the commitment from law enforcement is so important, because once these cases get into the court system, it's not a friendly place. And one of the things that, as I was musing about what I would talk about today, that was so important that I wanted to make sure I mention, is the fact that though most of our counties now are working, trying to reduce incarceration of people with mental illness, the fact is that our state laws and our criminal codes are very unforgiving. And in Arizona, we're one of only about 12 states, maybe a couple less than that now, that do not allow evidence of a mental disorder to be used in your criminal defense unless you're pleading insanity. So, if you've been following with us or working with us in our coalition, you've heard me say that a million times. And I'll probably say it a million more until we can change that in Arizona. We just had a speaker a couple months ago from Virginia who they've had the same type of laws even longer than we've had them. Ours have been in place since over 20 years. But it's very complicated. I'm not an attorney. I'm just a mom. My background was in nursing. So I knew a little bit about mental illness and the like, but very complicated. But the fact is that it would be, in my layperson's mind, it would be common sense to be able to introduce that for a prosecutor to consider, and to consider whether a person had the ability, the technical term is mens rea, to to know what they were doing and to have criminal intent. And in Arizona, you cannot use evidence of your mental disorder to disprove the fact that you had the mens rea. So basically what's happened through our state statute, which necessarily wasn't intentionally going to keep us from allowing this, but it was interpreted through the courts several years later in what's called the Mott's ruling, that definitely we're going to go hard line on this. We have chosen, in this case, went one of the cases that tried that set of laws went all the way to the U.S. Supreme Court. And basically it was just determined that Arizona had the right to create its own laws. So that's one of the most important things I want you all to continue to be aware of. That's the sad part of seeing where Arizona is at. Although our court leadership, for instance, at the Arizona Supreme Court, very progressive, very dedicated to seeing the change come. And if you're not familiar with the Stepping Up initiative, I urge and beg you to get familiar with it. Stepuptogether.org is the website. And in that website, there's a strategy lab that counties are using all across the country to utilize evidence-based practices so that we can divert people out of the justice system and keep them in treatment. Arizona is ahead of the game as far as I'm concerned when it comes to our law enforcement. For instance, Sheriff Rhodes in Yavapai County, that Beya is fortunate enough to be a part of that gang of folks. And you all living in Yavapai County should be so proud. I would use him as a shining example of the determination that our law enforcement has. And really, you'll see law enforcement in Maricopa County. We've had steady, tremendous support for years. And I say without the work that law enforcement's done, we'd be nowhere in this fight. I mean, they're the ones who make the other folks listen to us. So if you get what I'm saying, they don't necessarily, a lot of times you get labeled as a left-wing liberal that just wants to let everybody out of jail. But when law enforcement's talking, people listen. And so law enforcement is our friend in this fight. They're the best friend we've ever had. The Stepping Up initiative is, has been implemented or at least a resolution's been signed in all of Arizona's counties to reduce the numbers of people with mental illness in jail. And I just urge you all to be involved within your county in the place that you feel you can be most effective. You want to be able to applaud the good work that you see taking place. And at the same time, you've got to keep dragging up the things that still need work. So the way the situation is now, I hate to say it, but it seems as though your outcome still depends on the prowess of your attorney, your criminal defense attorney, the skill, the expertise that they have. Although, and what we want to see is for the system itself to be able to do the right thing, to discern if someone's, really needs to go to prison. And we need laws that allow those public officials, the court officials, the prosecutors, and who have so much power, our prosecutors, to do the right thing and improve outcomes for people with mental illness. And as well as I do, people with serious mental illness that are sent into the state prison system do not come back in better shape than when we sent them there. We see horrible suffering, high rates of suicide, and just a deterioration, and some never do recover from or spend the rest of their lives there. So again, I thank you, and I'll be looking forward to answering questions later, or just sharing anything else that you want to know about.
We will have questions and interaction after the other two guests have also spoken. So next I'd like to introduce Beya Thayer. Beya is the Executive Director of the Yavapai Justice and Mental Health Coalition. She works to develop and implement strategies that lead to the long-term and sustainable involvement of community institutions, organizations, and individuals within the intersections of justice and behavioral health, with the goal of addressing partnership and system change. And I can say that Beya has been working in behavioral health for a number of years, and she has been a real advocate for individuals with mental illness, and really helped make some differences with programs. So with that, I will turn it over to you, Beya.
Thank you, Lori. Thank you, everybody, for joining us today. It's a real privilege to have the opportunity to have this discussion with you all. The Yavapai Justice and Mental Health Coalition is a program of the Yavapai County Sheriff's Office, actually, but it is a true countywide coordinated community response to addressing the needs of people with behavioral health, unmet behavioral health needs, with behavioral health needs, and helping our system partners identify better solutions to support the community when somebody does come into contact with the justice system. And of course, our absolute biggest goal is that people don't come into contact with the justice system at all. But if that were to happen, then how can we use this as an opportunity to get a person connected to the support services that could benefit them and their lifestyle and their home and their health, instead of dragging them into through the criminal justice system, which really doesn't, like Mary Lou said, it doesn't come out more positive on the other end. We all know that. So years ago, probably about 5 years ago, the Sheriff's Office had received a Bureau of Justice grant, a federal grant, in which they were implementing a program in the jail to attempt to identify people with unmet behavioral health needs and connect them to behavioral health providers and deflect them and divert them and get them out of jail sooner than later, and provide them with the opportunity to say, hey, judge, look, when I was arrested, I was in this space, but now I'm working with my support system and I'm in a better space. And with that grant, the Sheriff's Office needed to implement a coalition of stakeholders. And at that time I was working for the REBA. And so I was a part of kind of building this little program together. And the sheriff the jail is kind of this weird hub where you can see a lot of what's going on in the community. And you can see what's happening in the different courts and the different jurisdictions and with the different law enforcement agencies. and with probation, just because of how people are coming into the jail and how they're leaving, or if they're leaving, and where the system kind of gets stuck. And so the sheriff had decided that they were going to take the lead. It's a very vulnerable position to be in, with so many different system players, of who's going to stick their neck out and try to take a lead on changing a system such as this one. This one being the courts, law enforcement, first responders, behavioral health, probation, county attorneys, public defenders, the jail. It's a lot of cogs and a lot of wheels spinning and a lot of bureaucracy. And it's really frightening. And what I have found working with multiple counties and being in this position as well, it's not that people in those systems don't necessarily want to change, or they don't see that there are barriers that people encounter to recovery, and that we're perpetuating some of those barriers. It's really turning a really big ship. And there's lots of big ships that have to kind of turn at the same time. So the sheriff's office decided to formalize this coalition, and I've been in the position of the executive director for the last 3 years. So we work with so many stakeholders across the spectrum between criminal justice, social services, and behavioral health services, and looking at the gaps in the system and where we can enhance processes and build bridges. Yavapai County does have a lot of resources, even though sometimes we look at it and say, oh, well, we're not Phoenix or Maricopa County, but there are opportunities there. It's how do we speak those languages, and how do we build the bridges? Criminal justice, law enforcement, the courts, probation, they don't speak the same language as the mental health providers. Everybody has this huge goal in the end. They want a big, happy, kumbaya kind of community, right? Like where everybody's thriving and participating. But our steps and how to get there look very, very different. So how do we come to terms with our different languages, and how do we open the doors to be able to provide the space available to lay the foundation to make these changes? And that's what the coalition is about and what we strive to do. Mary Lou had mentioned the stepping up agreement, and they have some great toolkits. And what we've done is we've used the sequential intercept model and data-driven justice and the stepping up initiative to try to be our background. And the sequential intercept model, it's been around for decades, but it's definitely getting some light. The court system, the Supreme Court, they're pushing it. A lot of folks nationwide are pushing the sequential intercept model. And it's 6 areas where a person with behavioral health needs can come into contact with the justice system, and opportunities to deflect or divert them out. So it starts with prevention, and then there's that law enforcement crisis piece, coming into contact with the jail. If you do get arrested, how can you get screened and identified and have the court system say, hey, this might have been due to somebody's behavioral health needs, or it doesn't. We need to use these opportunities to start connecting people to places that can support them when they're coming out of jail and when they're in probation. So the Yavapai Justice and Mental Health Coalition, we use the sequential intercept model to look at all the gaps and the strengths within our county, and where can we address and focus a lot of that effort to try to help build those processes with our stakeholders and with our community members in diverting and deflecting. So we have in Yavapai County mobile crisis teams. There's Taros and Spectrum mobile crisis teams that all of our law enforcement agencies know that they can call. And we do crisis intervention training 2 times a year for all the agencies across the county. That's a 40-hour training where people, first responders, law enforcement, dispatch, probation are all welcome to attend, detention officers. It really kind of gets into the weeds of identifying when somebody might be in a crisis due to mental health, due to trauma, due to autism, traumatic brain injury, Alzheimer's, like the whole spectrum, and give them tools on what they can do for deflection. Mental health first aid training is offered. We have a grant to train all law enforcement personnel across the county in mental health first aid training. We do screening and service connection for people who come and get booked into jail, and try to connect them to service providers as soon as they're getting out of jail immediately. We work with probation in enhancing their processes with the behavioral health providers. There's a lot of needs with social determinants of health. I think that that's up the river and where we really need to focus a lot of effort on. It's hard to get your criminal justice needs met when you don't have a safe place to live, or you don't have healthy food and you're worrying about what you're going to feed your kids. We don't have public transportation in Yavapai County, so it's really difficult to, could be difficult to obtain a job and get to a job and stay employed. So there's a lot of factors that we need to strengthen, definitely, and strengthen some processes to support our community and our population. And that's what the coalition is striving to do.
Thank you, Beya, so much. There's just a lot of work that's been done and a lot of work still to be done. But it's good to have people like you leading these programs.
And our next speaker is Dorothy O'Brien. And I call her Dot. I consider her a friend. I will say first, because I wrote down here, I have to say this, that because she is a family member and she's speaking about her daughter, she will not be mentioning her daughter's name. Should she mention her daughter's name, we will be editing that out of the video. And I'm not going to say her daughter's name either, to protect her daughter's privacy. So Dot she sent me her resume, and it went on and on and on. I can't believe how many accomplishments she's had. But in addition to the career accomplishments, she's also been a community organizer and in different community activities, and she has definitely been an advocate for the community and for the mental health community as well. And so with that, Dot, can you tell us about your story?
I sure can. Thank you for including me. Can you hear me all right?
We can.
Good. Okay. First of all, it's very bittersweet, let me just say, to listen to the things that are happening in the community, particularly Beya's work right now, whereas 5 years ago, that could have made all the difference in my daughter's life. Again, bittersweet because when you start with childhood cancer, and all the aggressive treatment that's done to save the child's life. As I mentioned originally, my daughter was part of a first cohort back in New York City of children that survived. Kids just didn't survive leukemia in the 70s and 80s. And so this was 1981, and they were still administering cranial radiation to a 2-year-old. So yeah, it saved her life, but there was no warning or sense other than the technician saying to me at the time, when she starts school, she might have a little learning disability. Oh my God. So now there's a lot more information, there's much more research that's been done, but the bottom line is that we have lots of family indicators where mental illness might have been a natural path for my daughter. I'm not blind to what happens in families. And we have a lot of addiction and so on. Any one of those things could have been part of her journey, you know. But I think the treatment to save her life really made a difference. And in fact, one of the most bittersweet things, receiving treatment she's 43 years old. So receiving treatment more than 20 years for mental illness, to learn literally this past month that the doctors in the state hospital are beginning to finally hear what we have been saying for decades, literally for years, that in fact, she doesn't have a mental illness. She has brain damage. Well, you know, it manifests itself surely, you know, in schizophrenia, in hearing voices and her behavior and her attention span and so on. There's all those elements. But the underlying thing, nothing that they do for her in the hospital is helping, nothing. And as many of our other speakers have said, the outcome is far worse. When I presented that young woman to the sheriff to take to the state hospital, she was an artist, she was writing, she was looking forward to getting well so that she could, you know, get on with her life and whatever that might turn out to be. And here we are in such a dark place. And she still tries. She's trying so hard. But there isn't anything. There is no chemical. There may be chemical imbalance, but the usual psychotropic, antidepressant, mood stabilizing medications do not work. And I can only say that our experience over the last 10 years, and then these past 5 years in the hospital, the 10 years that she spent here in the Verde Valley, I lay her current situation right at their feet. And the reason I do is because we made very sure that all the service people, all the doctors, all the support people knew what she was facing. But we were told time and again, do not talk about that. That has nothing to do with it. Over and over again, to the point where I am at the point in the state hospital where before I speak to anybody, I want to know, what is your education? What is your experience? You know, have you ever worked with someone with these kinds of issues? And if not, why are you part of my daughter's treatment team? I mean, I'm that desperate. So at this point, listening, I mean, it's given me great hope to hear our first two speakers, because that tells me that if a year, 2, 3, 4 years had passed before my daughter crossed that horrible path with the criminal justice system, you know, the outcome would have been different. And so that's really good news. And we'll continue to advocate for that to be the norm, not the unusual case. The other thing that I would say about that is the community awareness, you know, that has to grow. It really does take a village, and it has to grow so that if someone is acting out or making a public situation uncomfortable, why is that? Why are you calling the police? Why aren't you calling a social worker with experience or someone with crisis training or something? You know, it really is a paradigm shift, I think, for our communities, but we have to be the change. We know that, and that's why we're all doing this. We have to be the change. So I'm hopeful. I don't know what the outcome will be. I hope that the hospital is reaching out for the surviving population, which is what we've asked them to do, because there are other 40-somethings that lived through the treatment and the childhood cancer. And, you know, where are they? You know, what kind of treatment are they requiring? What's happening to them? I know that many of them are in similar situations, but so then what is the follow-up? how does that person live a life? We try to keep her from going completely dark. You know, we try to keep her from, but she has no will to do her artwork or to do anything like that at this point. And, you know, she's obviously depressed. She's been in the state hospital for 5 years. I mean, it's horrible. What I will say, as far as the criminal justice system goes, is that if it weren't for the judge in Yavapai County having an open mind and taking a look at her and saying, you know, understanding that this person is not a criminal. So what can he do for her? And he was bound, as Mary Lou and Beya have both said, he was bound by the laws that exist. We must change those laws. He did his best. He surely did. And we're grateful for that. But I go back to the time when my daughter first crossed into the criminal justice system, which was, and I'll tell you briefly, she came out of an inpatient situation where she had been threatening all kinds of things. Why she was released without anyone telling me, I know HIPAA, I know. But, you know, they released her to her own apartment, where there was a man who was using drugs and everything in her apartment while she's in the hospital. So she is dropped off at her apartment by a driver from the local mental health services, dropped off and said, come to the clinic on Monday morning. What, mental illness doesn't happen on the weekend? What kind of follow-up is that? And I will continue to rail against that, because in our work with the independent oversight committees, time and again, you read through those reports and time and again, it's follow-up, you know, simple human connection. You're in the mental health field. You drop my daughter off at her apartment. There's a strange man in her apartment. No one should be there. No one notifies me. We're 5 minutes away. The police officers that arrested her knew her. I made sure that all the police officers knew her. She was a vulnerable adult. Please, here's my phone number. You know, please contact us. I lost touch with her for 3 days. The officers, the body cams show the officers trying to take her to a hospital. We know this woman, she should not go to jail. We want to bring her to the hospital. And the prosecutor on duty saying, oh no, take her to the jail and we'll sort it out. We'll sort it out. We'll sort it out. And that was the beginning of this very, very horrible journey that so many families go through, so many people go through. I'm glad to hear that some of those things are changing. If the police had been able to call in a counselor or this crisis management team, what a difference that would have made. But at that time, it was just beginning and there was no service like that. So when we finally found her, you know, it was so heartbreaking. She was a shell of her person. She was in the jail in a complete distressed. She was a puddle of a person. I mean, it was horrible. So now, you know, she's at a point, certainly at a transition point. I don't know what that transition will be, but we're hoping to work with the team at the hospital to set her on a path to whatever the next part of her life is going to be. And hopefully it's not going to be in the state hospital. So there you go. I'd be happy to take questions or answer anything else when you get to that point. But thank you for this opportunity. It's not a pretty story and it doesn't have a happy ending, but I appreciate the opportunity to share it. Thank you.
Oh boy, Dot, and thank you. It's just heartbreaking to hear your story. Yeah, and I really appreciate your being here and sharing that with us. So we're going to open this up for questions. I want to ask everybody to raise your hand if you have a question, and we'll come to you. And there is a feature on Zoom that lets you put, an actual raise a hand. And if you don't know that, you can just put your hand up and then we'll see that. So we are recording. I just want to remind everybody we're recording this. And Candy's husband will be editing anything out that would need to be. So we're opening the floor to questions now.
We do have one in chat, and so it's, what county serves as a role model for decriminalizing mental illness?
I'd be happy to jump on that. I mean, of course, Yavapai is outstanding because the tremendous fact, well, it's outstanding in a lot of ways, but what makes it so different is that the leadership came from the sheriff's office. You see efforts going on in different counties. We have many counties that are doing fabulous work. As I'd mentioned before, prosecutors have so much power in this. The courts are needing to show leadership, and you have that county ecosystem that Beya so eloquently described, of all those stakeholders that need to be brought in, including community. And you will see different counties excel in different areas. And what I've observed in this is that it all depends on who the champion is that's going to stand up and lead the effort. So, Maricopa County, of course, being a county that has over 4 million people, is a different animal. They've had long-term commitment from county leadership, from folks at the jail, from folks in behavioral health. They did their sequential intercept mapping years ago, but putting it all together and keeping that champion to bring it all together. Like in Yavapai, the sheriff was able to stir up the group and has Beya there as a head, which is another just tremendous thing, because counties need a criminal justice coordinating committee, or some sort of, if not that, then the mental health criminal justice, the way they've done it in Yavapai, even more decisive to have immediate impact on the behavioral health world. But before that ever came about, there are counties that have the criminal justice coordinating committee. And for instance, Beya used to work in Coconino, where she had a subset of that larger coordinating committee doing behavioral health work. Much harder to do what she was trying to accomplish up there in Coconino, because the way the coalition was set up. But I want to say that I believe all of our counties have the potential to really bring change. But one of the things that we need to do, and one of the things that I've been trying to work on, and it's actually one of our projects this year, is to try to really force the hand of different counties that haven't showed a lot of movement recently, for whatever reason, to at least help us identify 2 or 3 either public officials, or it could even be advocates. Sometimes we see, for instance, in Gila County, doing tremendous work. Darren Fry works for CBI, but he kind of became the de facto criminal justice coordinator in that county. So, and that's an unlikely fit, and we really need county people doing the work. We don't need private organizations doing this, but you see private healthcare extremely involved. Look at Care First. Care First working with Access, doing court-ordered treatment study, and trying to create, that kind of boggled my mind, because I feel like county and state leadership need to step up more. But whatever partnerships work with private healthcare, it's good if it's going the right direction. So, be proud of Yavapai. You guys are outstanding. Never fail to give credit to your sheriff's office. That's what caused you guys to excel. And doesn't that just give you goosebumps? It does me. I remember Sheriff Rhodes, when he was chief, talking about how he'd walk along and look behind the bars and look at folks and say, why are you here? You know, they didn't belong there. It was obvious. And that frustration, part of the system, part of the impetus that made Sheriff Masher and Chief Rhodes at the time become so dedicated to, just because it's a human rights issue, that it's just fundamentally wrong. And it's not rocket science, like Judge Leifman will tell us in this, who's the creator of the Stepping Up initiative. This is not rocket science. We know how to fix the problem. So we've got good work going on in Pima. Mojave's working. They've got people at the jail trying to bring change, but bringing together that group that Beya described earlier, that's where you have the challenge in the counties. And they all need, first of all, they need encouragement, and they need recognition for the things they do right. And one of the things that we've always tried to do, recognize officers that have success, you know, recognize people in the systems that go beyond what they needed to do. That's how we bring the change, not by bringing up every bad outcome that we've ever had. And speaking of bad things, I want to just say to Dot that my heart just goes out to you. And
Thank you.
You are you are just in the middle of what has happened to so many people. And like you said, we do bring it back to, you know, law enforcement makes split-second decisions. They're in charge of public safety. They're not social workers. They're not doctors. When people do end up in jail, the courts, you know, directed by our state laws, should be able to sort some of this out. And like you said, the prosecutor mentioned, we'll sort it out. We can't sort it out when our laws are all mucked up. So in order to sort it out, we've got to make our laws so that you err on the side. We have to be able to err on the side of of not incarcerating people that have committed a crime due to their illness, rather than not allowing people to present evidence of their illness and then err on the side of incarcerating people that don't need to be incarcerated, which is what we do. And I just think this, also sad to hear about the state hospital. And it sounds like the culture there, because that, you know, we hope and love, you know, I've always loved to see, I used to be on the Human Rights Committee before they were independent oversight committees at the state hospital. And we want that to be a different place than a state prison.
Right.
So, but that's that. Sorry for taking too long.
No, you're fine. Mary Lou, and we'll get, I just wanted you had me put something up this morning, a document. I put it up on NAMI Yavapai, I put it up as a post. Can you explain that document and why you asked me to post it?
Thank you, Candy, for bringing that up. Yeah, just the Arizona Supreme Court has been working they've had 3 major committees working on mental health and criminal justice. They had a mental health court standards committee way back. Then there was a fair justice task force that had a mental health committee that came off of that. And then there was most recently one, Beya sat on that along with Sheriff Rhodes. And that last committee was a really lengthy, long committee. They have I think it's 86 pages. I was just looking at it again today, a report that was created for the outcome of the issues that committee addressed. Some of the issues were at the request of the Chief Justice at the time, which was Scott Bales, before he went into his retirement. But that report is a tremendous amount of information about, you know, what our state currently is looking at, our state leadership in the way of how we can bring better outcomes. And the purpose of that committee, as stated in the administrative order that created it, actually talked about improving outcomes. Yay. So improving outcomes, can you imagine? So they were trying to bring, it was very challenging and able to bring systemically. I mean, the committee had 20 some members with like 8 county judges. And to me, what we needed was more representation and more, you almost had to have a committee to decide who needed to be on the committee. I mean, I'm sure they did, but it needed to be more evidence-based, I guess. Getting the right people down there to have the influence and to have the input from peers. So, I mean, I was the closest person, I guess, to a peer because I was a family member that was on. And we kept talking about getting someone from OIFA down there. But that being said, look at the report. It's 86 pages. We hope that that was not the end of what the Supreme Court's going to do. The Supreme Court has shown tremendous, I mean, tremendous leadership. And I think they made us look in that committee better than we really were by the things. Don Jacobson, who wrote up that, who really put the report together, just tremendously experienced and knowledgeable. So they put out an order to all the counties. They wanted all the presiding judges of every county to do sequential intercept mapping, which Beya referred to. Coming from our Arizona Supreme Court, that's huge. That's like telling all your county judges you need to implement stepping up protocols in your county. So all the counties aren't done yet, but anyway, it's a critical piece, document. It's a work in progress. It's a lot to consume, but I really think that if you're interested in what the state leadership is seen as problematic, you might not agree. Sometimes I don't agree, sometimes, but be knowledgeable of what folks are looking at, talking about. If they're not talking about the right areas, that's an opportunity for you to get involved.
And there were some hands up before I interrupted. Okay, and can you, and I don't know your first name, but Stalling must be your last name, and you need to unmute.
Yep, I did. My name is Anastasia, and I'm down here in Tucson at NAMI. Quick question, really. I was just on the David's Hope. Does it work out of Olive State down here, just up there?
Thanks, Anastasia. So we're very small, very grassroots. I mean, we take calls from individuals that are seeking help in every county, but we do not provide direct services. Our direct services are counseling over the phone to help connect the person to where they can best get their help from.
Okay.
Or educating them about how the system's going to work and what kind of options they might have. So, and again, I'm not an attorney and we don't have attorneys working for us, but we do take calls and welcome calls, and we do have connections in most of the counties.
All right, thank you.
Thanks.
Okay, I'm not seeing another question right at the moment, but we've heard mention of the sequential intercept model a few times. Oh, and Ralph, just a second here. I'd like to see a show of hands. How many people are familiar with the sequential intercept model? Okay, not very many people here. So I'm wondering, Beya, if it may be beneficial to give a brief walkthrough, and if you want to pull up a map of it and share your screen, we can do that, whatever's going to work easiest. Can you do about a 5-minute walkthrough on that, or is that too short?
No, 5 minutes is fine. And let me pull up.
They've already had permission to share screens. I'm wondering if while you pull that up, should we have Ralph ask his question?
Yeah.
While you look for that?
Okay.
Okay, Ralph, go ahead.
Yeah, and unmute. So Adele's on from NAMI, Coconino Flagstaff, and she asked a question about Coconino County in a private chat between the two of us. So how does she find out the status of Coconino County was the basic question. And Adele, you can come on and unmute yourself and ask your question more distinctly, but I don't know quite where you go to find out the status of a particular county. I follow for the Northeast here for what's going on up here in the Apache and Navajo counties, but I don't know what else to say to her question.
I can share with you that your health plan up there, Health Choice, has an individual that is dedicated to justice and behavioral health. I don't know, Beya probably has her name. Beya can answer this one.
Yeah, so there's 2 individuals at Health Choice Arizona. One is Amy Bacon, and the other one is Sherry Brock. And they are the Justice Administrator and Justice Liaison. So they work closely with the different stakeholders there in Coconino County, well, for all 6 northern counties actually, but in Coconino County to try to create those processes and build partnerships. So the county's Criminal Justice Coordinating Council has a behavioral health subcommittee. Last I heard, it was still co-chaired with Sherry Brock, and Sherry is SHARIE BROCK. And Corey Runge. Corey Runge is retired sergeant from the Flagstaff Police Department, and he is now employed by the NAMI or the NARBA Institute. And they they would co-chair this subcommittee of the CJCC. If you go to the Coconino County government website, or maybe Google Coconino County Criminal Justice Coordinating Council, they actually have their subcommittees listed. I don't know if you can get into contact with somebody that way. They had a coordinator for a while, and that spot's been empty, so there's not somebody directly involved. Another person to find out what's going on in Flagstaff. I think that might be the easiest way. And let me give you Sherry's direct number at Health Choice. If it pops up on one of her email attachments. Hold on just a moment.
The other thing we can do, Adele, is make sure that you have Beya's direct contact information too.
Yes.
Thank you.
And Sherry is at 214-2326. And please feel free to tell her that I sent you her way.
Thank you.
You are
Appreciate
welcome. Yeah. Yeah, for sure. Okay, so let me see if I can make this thing. Okay, what do you guys see?
There we see it. Woohoo.
All right. I don't know how to get rid of the thing on the left.
Yeah, I brought that one up too, and I couldn't get that off. So Beya, we're just gonna have to deal with that.
Okay. So, whoops. Sorry, I don't mean to make you nauseous, like going on a roller coaster ride. Okay, so the sequential intercept model, and again, like you can definitely Google it and you'll find it, SAMHSA and the SAMHSA Gain Centers. This is the one that I believe I pulled up from them. So intercept 0, we look at as trying to be prevention. So what do you have going on in your community already in case somebody goes into a crisis so that you don't even have to call law enforcement? Do we have a crisis line? Do we have crisis centers? Do we have behavioral health providers that could come and assist? That's what's happening in intercept 0. In intercept 1, it kind of does dive into when law enforcement is contacted. So our muscle memory says, if there's something that I can't control or something that makes me nervous or something that's scary, our muscle memory says we call 911, which there is a movement to make 988 go to your crisis lines, and but it's still going to take a lot of community awareness and education. But 911, we call because our adult son is in crisis and we can't control him, or we call because somebody's making us nervous out on the street, or law enforcement comes across somebody. A lot of criminal charges for folks who are experiencing a mental health crisis come from disorderly conduct, trespassing, like all of those, a lot of petty kind of crimes. So if law enforcement comes to the scene, they come to your house, they see somebody on the street, how do they identify, how do they recognize that this is a behavioral health crisis that's happening, substance use, mental health? So how do they even identify it? How would the dispatchers identify it? That's why we need mental health first aid training, crisis intervention team training. And when they do identify it, what do they do next? So that's back to, can they call the crisis line? Can they call mobile crisis? Can they take somebody to a crisis stabilization unit? Do they have, maybe they don't even need to take somebody somewhere. Maybe they can just hand them like information that says, here's your local crisis number. How do they have that conversation to not arrest somebody? Intercept 2, unfortunately, people do get arrested, right? For regardless of whatever reasons. There could be victims involved. Their behavioral health might not have been identified. So this one is a very difficult one. And I remember calling actually the Samson Gaines Center and saying,
Okay. Are you back? You froze, Beya. You may have lost connection.
Yeah, it looks like we've lost Beya. And while we're waiting for her to come back, let's see if we can take some questions. I think that,
And then someone in chat just said, there's a compassion prison project.org. Did you want to talk about that, or did you want us just to read that?
I'm sorry, I got kicked off the internet.
Hold on. Okay, hold on 1 second, Beya.
Mostly just wanting to share that information. It's a great program. I'm not that familiar with, but there's at least one really inspiring video.
Okay, and so you might want to look at that too. So, and Beya, if you could go ahead and I know there's a lot to say about this, but if
I'll go quick.
Okay.
Okay.
Get more questions.
There we
want
go.
those. Yeah. There we
All right, so Intercept 3 is looking at, okay, so you're either in jail or maybe you're in the court system. What's happening while you're incarcerated, or what's happening while you're in the court system? Specialty courts are the mental health courts, veterans court, recovery courts that are trying to help a person go through the justice system and be connected to treatment at the same time. Great ones give you complete diversion. If you complete your treatment, it'd be nice to just have complete diversion and all your charges dropped, or sometimes they're lowered to a smaller charge. So you might not have a felony on your charge. It might be a misdemeanor. Then there's the whole point of reentry. What happens when the door opens and you walk out? Whether it's been 2 hours, 2 days, 2 weeks, 2 months, 2 years, what happens when you're coming out of jail? How quickly can you get connected to services? Can you get connected before you're out? Where are you walking to? Where are you getting dropped off at? Kind of like with Dot, just even coming out of the inpatient, it's the same kind of thought. Like, are you going to get, who's in your house? What support systems do you have? What can we do to make it more successful when you get out? And then Intercept 5 is back in the community. So what does that look like with probation or parole? How how can they work with the behavioral health? How can they work with your treatment teams? How can they be part of the treatment teams? And of course, this is written out very linear, but we all know that recovery is not linear. And so coming in and out might not happen in one and go through 5. It can bounce all over the place, but that's what the mapping is. And so the counties are tasked with, hey, go through and find out what you have in your community that addresses all these different points, and where's your barriers, and what can you kind of focus on to try to connect those processes to support folks who come in contact with the justice system.
Thank you, Beya. Go ahead.
Thank you so much, Beya. And I encourage people to take a look at this. It's easy, relatively easy to find it online, and read more detail on it, or go to the SAMHSA site.
Other questions?
Did you have one?
I do. So, well, actually, Dot, I have 2 things for you. Number one, I neglected to say that you were the chairman of the Independent Oversight Committee in Northern Arizona.
Oh,
And that's a very important committee. It does oversight our mental health facilities. Do I have that right?
absolutely. It's where our mission is to have that independent look at facilities and services that impact our most vulnerable neighbors. And it's been a challenge with COVID, no doubt, no question. But it's important, you know. Yes, and we're always looking for committee members. So if anyone has interest, shoot an email or something, and you know, we'd love to talk to you. But thank you. Thanks for mentioning that, Candy.
And also, I wanted to say, so the news is that the state hospital is now recognizing that many of your daughter's issues may be due to the radiation.
Right.
They don't have a plan. Do they have a plan yet? Or at least that's the first step?
Well, that is the big question. And so now, you know, other family members out there will understand the little drill. Every week, I send an email to the case manager saying, you know, has the team reached out for the doctor in New Jersey and New York where other survivors are being treated? You know, what is, you know, is she completely weaned off all the psych meds? You know, I ask every week. And so I don't have an answer to that. This week, I'll be a little more, you know, impatient because it's been 4 or 5 weeks now. So.
But at least it was a step.
It's a big step. It was a huge step. And, you know, I know the last conversation I had with her, she actually sounded best that she sounded in, you know, a year sounds like a long time, but she's been in a really, those medications put her in a dark place. And she sounded really pretty good. So that it's positive, you know. And of course, then the question becomes, then now what do we do with her? Where, you know, where are those places in our communities where someone like her can live their life, you know, and be safe and not be a danger to herself or anybody else? And, you know, I wish I could tell you as chair of that committee, oh, we have 4 or 5 places that, you know, that we're aware of, and it's not the case at all. It's not the case at all. So.
Beya, I see you shaking your head.
Yeah, one of the biggest frustrations that we're seeing as a community as a whole is a disconnect or a lot of unanswered questions about people with like cognitive brain injuries, Alzheimer's, dementia, traumatic brain injury. They don't fit in our system or in our laws, in our books, in the Medicaid system. They just, on all the systems that we have, we haven't really built a great bucket for all these ideas of how to have somebody with supportive housing and supportive care. Now, what's going to happen, I'm thinking through what's with DOT, you know, the behavioral health community is now going to be like, okay, well, it's a medical condition. The medical people are going to be like, well, I mean, there's still like a behavioral health thing going on. Who does what? Altex is going to have to get involved. I don't know if you guys have ever dealt with Altex, but that one is a whole other, you have to apply multiple times. They'd have to prove for disability through something that has for 20 something years has been called a mental health disability. So Altex isn't going to understand what's going on. Yeah, I'm so glad that, you know, she's getting off of medications that she doesn't need to be on. But now that, right, the case manager's probably like, I don't know what to do. We haven't laid those pavers and built that road.
Right.
And it needs to be built.
Yeah. Well, we know that there are survivors. We know that they're being treated somehow. We know they're living somewhere. So I've asked them, reach out. I have I presented them with the numbers and institute names that treated her back east, and they are treating the survivors. So that's another part of it that I completely eludes me by, you know, here's a number, call this number, please, you know. I don't know. We'll see. Yeah.
Ralph, you have a question, and then Stephen after Ralph.
Yeah, just a comment. This is not directly about Dot's daughter and that particular form of brain damage, but the question was raised about the intersection between behavioral health and mental health in our healthcare community. And I'm not talking the insurance part of it. I'm talking the actual healthcare part. One thing that I can report from our area up here in Navajo County is Show Low has the main hospital, Summit Hospital System, and they have taken the 5th floor and created a geriatric mental health facility, if you will. So that's not an answer for all of the needs of where should people be housed, but it is an interesting development out here in rural America to have a major health system devote part of their floor space to actually, you know, right down, the floors down below are all physical health. And the 5th floor is mental health. So it's a positive development, I think.
It's a good step. Yeah. Thank you.
Stephen.
Good morning. And first of all, I want to thank Mary Lou, Thayer, Dorothy, others. I'm taking some copious notes here. And it's been at least a year since I've been with Dorothy. And we live right down the road, but Iris and such. And all I wanted to really point to, my personal journey with the O'Briens came as a NAMI facilitator in Sedona. I sat and I held space and I heard the stories month after month after month. I didn't have that personal experience. My experience with my mother was not in law enforcement or the mental health system. So I held space. And when Dorothy's daughter was arrested, I was present to a lot of that. I was with the O'Brien family. I saw that and I just assumed things would happen. Some of the things that I learned in my training was, well, NAMI, facilitator, have other social work training and community advocacy in Stepping Stones in Prescott. So I'm kind of aware, if I can help, if there's something I can do, NAMI, pointing to advocacy, said, okay, well, this is actually helping my peace of mind and well-being. I had no idea that Dorothy's journey would become my training ground in advocacy. And some of the things that I learned that had no idea. The cop on the ground who wanted to take her daughter to the hospital and was overridden by the county attorney. Police officer was on the ground. I don't understand this. Case management, there were some things, and again, I started to learn the complexities. Well, she's ill. I understand that, and understanding some of the ramifications of bringing a person that has a validated medical issue and dropping them into classes like CBT with people that are not in the mental health system or in the criminal justice system, but are mandated to get some support. So, and I saw, and real problems came from that. And I remember sitting in the mental health court in Prescott with the O'Briens. That was my first round, quietly thinking, do I want to be involved in this? I want to see what this is. And I walked out thinking, okay, they get it. They have a mental health court. So now we get it. Dorothy's daughter will be diverted. No, right back to Judge Bluff. And I don't know if I was supposed to say that, but, and I saw that he got it. I didn't understand, I had no idea that the circumstances behind the arrest, medical circumstances, would be completely irrelevant. I've had attorneys in Arizona that are not savvy to this tell me, no, I don't believe that. And I'll just say briefly, all the things that I'm speaking to, and I've been from her family sitting around a conference table in Sedona to sitting around a conference table with the providers in ASH. And yeah, Dorothy, this one changed me. But what I could pull is on the ground, not at the policy level, but on the day-to-day on the ground. There have been so many opportunities that I've had to be able to point people to some of the resources that you're offering right now, and to educate and to support in any way that I could. And just as a community member, so I just want to thank you all for what you're doing, what you're trying to do. I know there's a personal story behind every single one of you that are sitting here this morning, and I want to thank you for your work.
Thank you, Stephen.
Thank you, Stephen. Before we go into announcements, I wanted to ask Beya one more question. Fortunately, things have changed since Dot's daughter had her unfortunate turn of events. With the new programs that we're seeing in Yavapai County, is it too early, or are you able to talk about outcomes where people have gone through the diversion programs and because they've chosen to go into treatment as opposed to jail, and it takes a certain level of offense to qualify for that program, but are you seeing outcomes where people have come through recovery and not going back into jail?
I'm not sure which exact program that you're talking about. I know that the county attorney implemented a true diversion program. And when I say true, I mean that if it's completed, the person does get their charges dismissed completely. And the provider, the treatment provider, it was a partnership between West Yavapai and Spectrum Healthcare called Complete Care. I don't know what their recidivism numbers are at this time. Our reach out program in the jail, which it doesn't matter what your charges are, like we'll try to connect you regardless when you're getting out, or work with the public defender and the county attorney and trying to get people out and into inpatient or into residential treatment if needed. And any kind of connection with those, we keep track of those numbers, but you know, the release coordinators, they work with kind of the highest risk and the most vulnerable people. And so no matter what, they're always going to have the highest recidivism rates, right? Like we're noticing what we're good at tracking is kind of what people are disclosing when they're coming into jail, where they fall under their risk factors. And you know, who is getting connected and how can we make those connections better? But I could tell you what the general, like with everybody's recidivism is at this moment. It's about 18 point something and a half %. And that's looking at over a post-release for 2 years. So that's a really long tracking record. But we didn't have pre-reach out data, right? Like I can't compare it apples to apples. What we could just do is like just kind of keep tracking what we're doing as we're going along.
Okay, thank you. And certainly COVID has impacted, you know, the lack of in-person services over a period of time. So I just want to again thank Mary Lou so much, and Beya and Dot for being here today, and everyone else who has participated.
And if you have any suggestions for future programs, please, we need those. So if you'd like to continue this conversation or whatever, please let us know. Thank you for coming.